You check your blood pressure at home. The screen shows 160/100, or maybe 180/120. But you feel fine. No chest pain, no dizziness, no obvious warning. So you think, maybe it's not a big deal. That is the dangerous part. High blood pressure can silently damage your heart, brain, kidneys, eyes, and blood vessels for years before you feel anything. And sometimes, a very high reading is not just high blood pressure. It may be a warning sign that you need urgent medical care. In this video, we will use AI-assisted health education and evidence-based medical guidelines to explain when a blood pressure reading may be dangerous, which symptoms you should never ignore, and what questions to ask your doctor. AI can help organize your readings and symptoms. Blood pressure is written as two numbers. The top number is systolic pressure. The bottom number is diastolic pressure. For example, 120/80 means the systolic pressure is 120 and the diastolic pressure is 80. But one number alone does not tell the whole story. The 2025 AHA and ACC High Blood Pressure Guideline and the 2024 European Society of Cardiology Guideline both emphasize that blood pressure should be interpreted with proper measurement, repeated readings, cardiovascular risk, and clinical context. That means one high reading after stress, exercise, caffeine, pain, or poor sleep may not prove you have uncontrolled hypertension, but repeated high readings should not be ignored. High blood pressure is often called a silent condition. Many people have no symptoms at all, but over time, uncontrolled blood pressure increases the risk of heart attack, stroke, heart failure, kidney disease, vision problems, and blood vessel damage. The SPRINT trial, published in the New England Journal of Medicine, showed that more intensive blood pressure control in selected high-risk adults reduced major cardiovascular events compared with standard control. This does not mean everyone should aim for the same blood pressure target, but it shows one important truth: blood pressure control matters. Before you panic over a reading, make sure it was measured correctly. Sit quietly for a few minutes. Keep your feet flat on the floor. Support your back. Place your arm at heart level. Use the correct cuff size. Do not talk during the measurement. Take more than one reading and record the results. The American Heart Association and American Medical Association support self-measured blood pressure monitoring at home when it is done properly. AI can help you organize your home readings into a clear log. Now, let's talk about the number many people worry about: 180/120. A blood pressure reading around 180/120 millimeters mercury or higher can be serious, especially if it is confirmed with repeated proper measurement. If your reading is this high, sit quietly and repeat it after a short rest. But if the reading stays very high, or if you have warning symptoms, do not wait. The American Heart Association scientific statement on elevated blood pressure in acute care emphasizes that very high blood pressure must be interpreted with symptoms and signs of possible organ damage. In simple words, the number matters, but the symptoms matter even more. Here are the warning signs you should never ignore. First, high blood pressure with chest pain. Chest pain with very high blood pressure can signal strain on the heart or a serious cardiac problem. If you have chest pressure, tightness, pain spreading to the arm, jaw, neck, back, or shoulder, seek emergency care. AI cannot rule out a heart attack. Second, high blood pressure with shortness of breath. Difficulty breathing with very high blood pressure may be linked to heart strain, heart failure, lung problems, or another urgent condition. Do not monitor this casually at home for hours. Third, high blood pressure with severe headache or confusion. A headache alone does not always mean a crisis, but sudden severe headache, confusion, fainting, unusual behavior, or trouble staying alert with very high blood pressure should be treated seriously. Fourth, high blood pressure with vision changes. Blurred vision, sudden vision loss, double vision, or dark spots can be concerning, especially if they appear suddenly. Very high blood pressure can affect the eyes and may also appear with neurological emergencies. Fifth, high blood pressure with weakness, numbness, facial drooping, or trouble speaking. High blood pressure is one of the most important risk factors for stroke. If someone has very high blood pressure and suddenly develops one-sided weakness, numbness, facial drooping, slurred speech, confusion, or loss of balance, call emergency services immediately. Do not drive yourself. Do not sleep it off. Time matters. 6. Repeated high readings. One high reading can happen, but repeated readings over days or weeks, such as 150s, 160s, or higher, should be discussed with a healthcare professional. Repeated high readings may mean your blood pressure is not controlled. 7. High blood pressure in high-risk people. Blood pressure becomes more concerning if you also have diabetes, high cholesterol, kidney disease, previous stroke, previous heart attack, smoking history, obesity, older age, or a family history of early heart disease. The same blood pressure number can mean different things depending on the person. That is why doctors look at the full picture, not just the monitor. So what can AI safely do? AI can help explain blood pressure numbers. AI can organize home readings. AI can highlight warning symptoms. AI can help prepare a question list for your doctor. For example, are my readings consistently high? Should I monitor blood pressure at home? How often should I measure it? Could my heart, kidneys, brain, or eyes be affected? What symptoms mean I should seek emergency care? Do I need lifestyle changes, medication, or follow-up testing? Let's summarize. High blood pressure can be silent. Repeated high readings should not be ignored. A reading around 180 over 120 or higher may be dangerous, especially with symptoms. Seek urgent medical care. If very high blood pressure appears with chest pain, shortness of breath, severe headache, confusion, vision changes, weakness, numbness, trouble speaking, fainting, or symptoms that feel sudden, severe, or unusual. AI helps you understand your readings. Doctors diagnose and treat disease. Emergency care saves lives. AI-assisted information cannot replace a licensed healthcare professional. If you have very high blood pressure with serious symptoms, seek emergency medical care immediately. If this video helped you understand high blood pressure warning signs, please like the video and subscribe for more evidence-based AI health education. Comment below. What should we explain next? Pre-diabetes and A1C, fatty liver on a health report, acid reflux warning signs, insomnia, or abnormal blood test results. Your comment may become the topic of our next video.